Ladies and gentlemen, esteemed colleagues, it's my pleasure to welcome you on the occasion of the restarting of the Central Eastern European Academy of Oncology. I'm thankful for your extremely successful contributions, which have gained worldwide recognition. I am especially thankful for Mr. President Zoltán Mátrai and Mr. Vice President Kaprin's outstanding work. I'd like to use this opportunity to talk about the oncological data pertaining to our region and the National Cancer Control Program, because the country's own anti-cancer program is foundational in the struggle against cancer. The worldwide increase of cancer incidence should alert all countries to develop more effective strategy for cancer control. It should be noted that 4 million new cancer cases could be detected in Europe, as suggested by the WHO. The incidence rates of cancer in Europe are among the highest in the world. By 2040, this number is projected to further increase to more than 5 million cases. To address the cancer burden in Europe, the EU's Beating Cancer Plan and the Cancer Mission have been launched. In both programs, the Central Eastern European region will have prominent role. There are inequalities between the Eastern and Western European countries in cancer burden that is more significant in the CEE region. On basis of age-standardized incidence and mortality rates, Hungary is in the first place among CEE countries. Our data are very precise. It may be noted that incidence show similar pattern among EU countries in general. However, standardized death rates are higher in the CEE EU countries. Therefore, it is vital that the EU's Beating Cancer Plan and the Cancer Mission is focusing on reducing these inequalities between the European regions. It is quite obvious that great differences in cancer frequency among the CEE countries could also be observed. The different incidence and mortality rate of cancer in CE countries is partly due to different risk factors, different organization of cancer screening, historical traditions, differences in national health policies, and financial resources. It should be here noted that the Hungarian National Cancer Registry has been operating since 1999 in a centralized manner and hence provide more precise data compared to other countries in the region, which surely contributes to the regional differences. Hungary has approximately 84,000 new cases annually. That is expected to increase to 100,000 by 2030. The trends in Hungary show that despite of the increase in incidence, mortality has been stagnating in recent years and even showed a slight decline. This reflects that the efficacy of treatments are dynamically improving. The National Cancer Control Program is a public health program in Hungary. The Hungarian government accepted a new national public health program, which has 5 major pillars related to the most frequent causes of diseases. One of them is the National Cancer Control Program. The establishment of the Hungarian National Cancer Control Program started as early as 1993 and has been accepted by the UICC and the WHO. The principles of WHO was based on 5 continents programs. From Europe, the Hungarian program was chosen on Vancouver meeting of WHO in 1993. The updated version has been prepared in 2018. This new version of Hungarian NCCP has been accepted as governmental program by the Hungarian government in 2018. I would like to introduce you the major achievement of this program, including establishment of population-based cancer registry, organization of screening breast, cervical, and colorectal cancers, establishment of oncotherapeutic protocols since 1994, development of the Hungarian Oncological Network, and an IT network among cancer centers in the country. The main goal of the newly accepted national program in 2018 is to decrease cancer mortality by 10% until 2030. The Cancer Control Program has the modalities recommended by the WHO. Apart from the well-organized prevention programs and the developed oncology network in the whole country is also of paramount importance. The OECD organization suggests hierarchical structure of cancer care. The Organization of Oncological Care of Hungary is summarized on this slide. In Hungary, primary healthcare is based on a network of family doctors. Oncological care is organized using progressivity levels. The basic level is represented by oncological care units of small municipal hospitals. At medium level, county cancer centers provide cancer treatment for 500,000 inhabitants. Regional cancer centers are responsible for the cancer care of 1.5 million Hungarian inhabitants. The National Institute of Oncology is the only accredited comprehensive cancer center in Hungary since 2006. Structured networking of oncological care promotes the harmonization of treatment for cancer patients. It improves the efficacy of oncological care and provides equal opportunity for all patients to receive high-quality treatment. The regional organization of Hungarian oncology care is depicted on the slide. The different size dots represent the 5 regional cancer centers, the county hospitals, and the city hospitals. The result of Hungarian oncology in the past 30 years are summarized as follows. As a result of these activities, cancer death rate is stabilized in spite of the significant increase in cancer incidence. In order to join efforts and address cancer burden in a regional level in the CEE region, The Central and Eastern European Academy was founded in Budapest in 2019 by the Hungarian government. Members are committed to combat cancer together in the field of cancer prevention, diagnosis, treatment, education, and research. A representative of 20 countries, including several ministers of health and other representatives of CEE countries, signed a declaration on the occasion of Regional Ministerial Conference on Partnership and Cooperation in Oncology, held in Budapest, 12th June 2019. The major mission of Central Eastern European Academy of Oncology is the harmonization of various national cancer control activities of CEE countries in the field of early detection, diagnosis, treatment, cancer research, and education. Cancer control activities of each country should be based on the data of cancer incidence and mortality rate. The main goals are to increase the level of multidisciplinary oncological care in the region, to facilitate evidence-based clinical practice in oncology, to facilitate as standard of care the multidisciplinary tumor board decision-making, to facilitate education and training of oncologists in the region, to facilitate the establishment of the centralization of oncological care, to organize regular scientific meetings, workshops, live or via internet. I'm convinced that this Academy of Oncology contributes to development of health cooperation based on friendly relations among CEE countries and will fulfill an important role in achieving the objectives of the cancer mission and the EU's Beating Cancer Plan. The parties agreed on the content of declaration that related to the following items. The participating countries should agree on the need to harness common knowledge by sharing their effective methods and the best practices of prevention and treatment, while acknowledging the importance of supporting regional-level research and development, as well as innovation activities in favor of the future-oriented and productive development of oncology. CEE countries shall mutually strengthen direct cooperation between health institutions, which special emphasis on the exchange of experts, health professionals, for the purpose of mutual exchange of experience, as well as further development of joint activities in the sector. Despite of differences in cancer care in CEE countries, cooperation shall be focused on the following priority areas: harmonization of national cancer control programs, development of an oncological network, harmonization of oncotherapeutic protocols, organization of multicenter clinical trials, collaboration in various fields of cancer research, training of health professionals in all fields of cancer care, organization of scientific meetings and workshops. I would like to outline the structure and function of Central Eastern European Academy. This academy is an international organization with a headquarters in Budapest. Academy is governed by the Presidium. Academy elects an international scientific board of delegated academics from the collaborating countries. Development of a core curriculum to provide common requirements for training of oncological professionals, organization of international scientific meetings and workshops in the field of oncology, academies supported by a Hungarian governmental foundation. Hungary suggests some important issues of cancer care for the future collaboration to CEE countries. Future development and collaboration, increasing the efficacy of screening by identification of new biomarkers, introduction of early detection of lung cancer by low-dose CT, improvement of non-invasive techniques in cancer surgery, utilization of robot-assisted surgery, creation of an updated guideline for systemic therapy, organization of multicentric clinical studies, and harmonization of further development of new targeted therapies. Besides funding the Central European Academy of Oncology, Hungary also partakes in several initiatives such as the IPAAC program, a joint action focusing on harmonizing national cancer control programs. The program brings together 44 partners from 24 European countries. Hungary is represented by National Institute of Oncology within the framework of the IPAAC project. Harmonization of an oral cancer early detection pilot program in Hungary is under development. Its overall aim is to reduce inequalities in access to screening services, especially in socially and economically disadvantaged areas in Hungary, and reduce preventable cancer deaths. In addition, Hungary recently joined the IARC in 2019 as the first country in the CEE region. Cancer surveillance, health economic assessment, epidemiology, and research on the etiology of cancer are among the key domains in which Hungarian researchers have been particularly active. Research on screening for cervical, breast, and colorectal cancer, as well as head and neck cancer, has also been an important focus area. European experts have formulated recommendations for the cancer mission that was published recently in Molecular Oncology. The CE Academy of Oncology will play a pivotal role in the regional outreach of the mission in order to reduce cancer burden inequalities to benefit citizens of the EU. In addition, from a quality perspective in cancer care, 100 European core quality standards for centers providing cancer care and research were developed by the OECI, Organization to Reduce the Inequalities in Care. The standards were published in the Lancet Oncology. Comprehensive cancer centers, such as the National Institute of Oncology in Hungary, are key to the EU initiatives in reaching their objectives as they not only provide state-of-the-art in care, but also focus on research and education to benefit the patients. The National Oncological Institute received its initial accreditation in 2008, and with this were among the 4 centers who participated in the first accreditation round in the history of the OECA accreditation and designation program. The title was renewed in 2014 and recently 2018. Ladies and gentlemen, many thanks for your kind attention.